Hello, my name is Dr. Jeff Bush. I'm part of the Ipswich Family Dental group of dentists, and today we've put together a video to show you our patients how to look after your braces effectively and keep them clean during your orthodontic treatment. One of our senior assistants, Carla, will now take you through what we consider to be a good, thorough cleaning technique so that we can provide you with the best possible outcome during your orthodontic treatment. So please enjoy the video by Carla.
Okay Naomi, so today we've introduced braces, and that means there are a lot more surfaces and nooks and crannies for you to clean. So we're just going to give you some tips and pointers on how to look after everything while it's in there, okay? Alright, so the same as you usually do at the beginning of the day and at the end of your evening, last thing before you go to bed. And also at school, or we'd really like you ideally to wash or at least rinse every time after you've had something to eat, okay? So I'll just give you a few pointers. If you open gently, so we can see there's a lot more surfaces to clean. So a nice soft bristled brush with a small head, not necessarily this one, but one that's similar. I'll just gently tease back your lip, Naomi. There, you let me know if I'm hurting you at all. So coming in at an angle of about 45 degrees, gently, where the gum meets the tooth and underneath the brackets and the wire, a gentle jiggle or a roundabout motion, but still quite firm with your soft bristled brush. And you're to do that all along the lower and all along the top too. So if you can see, once again, angling the bristles up at about 45 degrees, a gentle jiggle, not a sawing motion, and taking particular time so you reach each tooth. Alright, and then what we like you to do is, if you open again for me, Naomi, you're doing the same thing from the top, okay? So vigorously, gentle jiggle all the way around, as well as opening nice and wide, please, Naomi. The tops, or the occlusal surfaces, all the way back, all the way to the front, okay? All the way around the lower arch and the upper arch, and then coming from the inside at an angle again, 45 degrees down for the bottom, gentle jiggle, making sure you don't miss any of those surfaces, and all the way around the front. Coming towards the front, you can turn your brush lengthways because it's quite narrow, this arch, and nice and wide again, Naomi. Gentle jiggle and a flick, gentle jiggle and a flick. You can come from the side if you can get in. Same thing at an angle, gentle jiggle and a flick. Alright, so you're going to do the same thing up the top, so all your chewing surfaces nice and wide, and the same thing, so all the way back, Naomi, coming all the way around the front, and the same thing, okay, at an angle up about 45 degrees, gentle jiggle and a flick down. Alright, you might find it difficult to floss for the duration while the braces are on, so we encourage you to use something called an interproximal brush. Okay, so it looks a bit like a toothbrush, but it's got a flexible head, tiny little Christmas tree. Alright, so nice and wide again now.
Yeah, we're off. Yeah.
Show you how to gently do that. So once again, you can encourage that between the teeth, gentle jiggle, under the wire, between the teeth, gentle jiggle, alright? And you can do that all the way around. It's a bit easier to use for floss, alright? It's still important to get into those in-between surfaces. Alright, if you want to, you can come from the inside, so gentle jiggle. Does that feel okay? Alright. There may be some areas that are a bit tight, just do the best you can. Those front ones are a bit tight, but if you're coming from the front, we're having success there, okay? If there's a little bit of bleeding and puffiness, don't be put off your brushing. Get stuck in a little bit more with your nice soft bristles, okay? Clean gums are healthy gums, alright?
Thank you, Carla.
Oh, my pleasure.
Thank you, Naomi.